Can you have a DIEP flap reconstruction after you've had a tissue expander? The answer is yes. You can pretty much have a DIEP flap operation after any other type of breast reconstruction. Whether it's been successful or failed, if you have an abdominal donor site that will work and function to provide us with DIEP flaps, you can have your implants removed, expander removed, or nothing. And we could start from absolutely nothing, and we could reconstruct your breasts with the DIEP flap if you have DIEP flaps on your body that are usable. And if you want to know whether or not you're a candidate for DIEP flaps, check out my other video where I talk about am I a DIEP flap candidate. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.